Hello and welcome to Phreology. In today's video we will be looking at the diagnosis of schizophrenia. What is schizophrenia? Schizophrenia is type of psychosis characterized by a profound disruption of cognition and emotion. The peak of incidence for onset is 25 to 30 years and cases prior to adolescence are extremely rare. Overall there are no gender differences. A similar number of men and women are diagnosed with the disorder. However, the disorder often appears earlier in men than women. Psychologists today use the DSM and ICD to diagnose a patient with schizophrenia. In order to diagnose schizophrenia, the mental health profession developed the DSM, Diagnostic and Statistical Manual, which is particularly used in the USA. It is also used as a basis for the ICD, International Classification of Diseases, used by the World Health Organization in classifying all disorders, mental and physical. You may come across the terms DSM-5 and ICD-10. These refer to the latest editions of the two classification systems. Schizophrenia consists of positive and negative symptoms. Negative symptoms appear to reflect a diminution or loss of normal functioning. Positive symptoms appear to reflect an excess or distortion of normal functioning. Examples of positive symptoms are hallucinations, delusions, disorganized speech and catatonic or disorganized behavior. Examples of negative symptoms include alogia, also known as speech poverty, avolition, affective flattening and anhedonia. We will go over what these mean in more detail later on. In order for someone to be diagnosed with schizophrenia, according to the DSM, they must fit three criterion: A, B and C. Criterion A. Symptoms. Patients must have two or more symptoms, positive or negative. Only one symptom is required if delusions are bizarre or hallucinations consist of a voice keeping a running commentary on the person's behavior or thoughts, or two or more voices conversing with each other. Criterion B. Social. Occupational. For a significant portion of the time since onset, one or more major areas of functioning such as work, interpersonal relations or self-care are markedly below the level achieved before onset. Criterion C. Duration. Continuous signs of the disturbance persist for at least 6 months. This 6-month period must include at least 1 month of symptoms, or less if successfully treated, that meet criterion A. During non-active periods, disturbance may be limited to negative symptoms. Now, let's talk about positive symptoms in more detail. Positive symptoms are an excess or distortion of normal functions, for example hallucinations, delusions and thought disturbances such as thought insertion. Hallucinations. These are distortions or exaggerations of perception in any of the senses, most notably auditory hallucinations. Hallucinations involve disturbances in perception, rather than disturbances in thought. They are false perceptions that have no basis in reality. The most common hallucinations are auditory ones, hearing voices, but can include smell, touch and sight. There may appear to be a single person talking or many, and they may be familiar or unfamiliar. Many schizophrenics report hearing voices that instruct them to do something, or that tell them they are wicked and evil. Sometimes they instruct the patient to do something that could be harmful to themselves and others. Delusions. Delusions are false beliefs that are firmly held despite being completely illogical, or for which there is no evidence. Common types of delusions in schizophrenia include the following. Delusions of persecution. The belief that others want to harm, threaten or manipulate you. Schizophrenics may believe that they are being spied on, that nasty rumors are being spread about them or that people are plotting to kill them. Delusions of grandeur. This is the idea that you are an important individual, even godlike, and have extraordinary powers. One of the most frequent of this type of delusion is the belief that they are Jesus Christ. Delusions of control. Individuals may believe that they are under the control of an alien force that has invaded their mind and/or body. This may be interpreted, for example, as the presence of spirits or implanted radio transmitters. Delusions of reference. Events in the environment appear to be directly related to them. For example, special, personal messages are being communicated through the TV or radio. Disorganized speech. This is the result of abnormal thought processes. They may slip from one topic to another, known as derailment, even mid-sentence. Speech may be very incoherent and sound like gibberish. Disorganized or catatonic behavior. Inability or lack of motivation to finish a task, which leads to difficulties in daily living, for example, can result in decreased hygiene interest. Bizarre behavior such as wearing warm clothes in the summer. Catatonic behaviors are characterized by a reduced reaction to the immediate environment, rigid postures or aimless motor activity. Schizophrenia can also cause negative symptoms which cause a decline in functioning. Negative symptoms appear to reflect a loss of normal function. For example, sufferers may not be able to work at a job that requires the same level of skill or concentration as the job they held before they became ill, or they may lose all ability to withstand the stress of working. The illness can also affect their ability to function at home. For instance, they may be unable to complete household chores, raise their children, or maintain an active social life. Speech poverty. Speech poverty or alogia is the inability to speak properly, characterized by lack of ability to produce fluent words. This is thought to reflect slowing or blocked thoughts. It can manifest itself as short and empty replies to questions. People produce fewer words in a given time and have difficulty spontaneously producing words. Avolition. Avolition is the reduction, difficulty, or inability to start and continue with goal-directed behavior. It is often mistaken for apparent disinterest. Examples of avolition include no longer being interested in going out and meeting with friends, no longer being interested in activities that the person used to show enthusiasm for, no longer being interested in anything, sitting in the house for many hours a day doing nothing. Affective flattening. Affective flattening is a reduction in range and intensity of emotional expression, including facial expression, voice tone, eye contact, and body language. When speaking, a patient may show deficit in intonation, tempo, loudness, pausing, i.e., their speech will sound very unnatural. Anhedonia. Anhedonia is a loss of interest or pleasure in all or almost all activities. Patients suffer a lack of reaction to normally pleasurable stimuli. Physical anhedonia is the inability to experience physical pleasures such as food and bodily contact.